Hi everyone, we have with us Dr. Vanshika Arora, rank 7, INICET November 2022. Heartiest congratulations. And I'll request her to do the honors to the cake. Proud DAMS student, we are very, very proud of her achievement, and the entire DAMS team wants to congratulate her and her parents. I would request the mummy papa to feed her some cake. Heartiest congratulations. Now, sir, thank you.
Thank you so much, sir. Congratulations.
Congratulations to all of you.
Thank you.
Congratulations, ma'am.
Congratulations, bache.
Thank you so much. I think Vanshika has done exceedingly well, and she's a very, very hardworking child, and she's made her parents proud, and we would congratulate the parents for supporting her throughout her journey and wish her all the very best for her future endeavors. She's going to be a great clinician, or whatever branch she's going to pursue, she's going to excel in it. So congratulations, Vanshika, once again.
Now I'll request Dr. Deepthi to take a interaction with her so that the future aspirants can get to know how to go about the exam preparation and what she did right, what she did wrong, and what they can learn from it.
Definitely, definitely. So Vanshika, congratulations once again. Aja. It's your day, and you know, I'm feeling really happy and very, very honored to be sitting besides you. You've done so well, and I want to know, Vanshika, कि जब हम शुरू कर रहे थे, I'm sure there was a lot going on in your mind, and you've always been a bright student, a hardworking bacha, but a lot of effort goes into reaching where you have reached. So let's start your journey from scratch, Vanshika, and you've been a DAMS 3-year student.
Yes. Foundation.
So we would definitely want to know how your journey has been so that, you know, you inspire others. You are a very, very pleasant girl, and I'm sure she's going to be a very helpful senior as well. So let's hear from Vanshika.
Ma'am, I joined DAMS in my 3rd year, and the first class I attended Sumer sir's radiology classes in the auditorium. He was very inspiring actually, and he taught radiology in a very nice manner. I developed so much interest in the subject from there.
Okay.
And after that, we attended the online classes, some of them.
Yeah.
And I used to attend the test and discussions in the internship.
Okay.
So I used other platforms as well, and I completed all my notes. And in internship, I started revising. I did my clinical subjects till the 4th year.
Right.
And then in the internship, I started with my 1st and 2nd year subjects.
Okay.
And I used to attend TNDs in Gautam Nagar. And ma'am, your test and discussion class was amazing. I saw it online. Very concise notes for the last moment revision. I saw that. Ma'am, I think that's all.
Okay, so let's now take it from here. So we know that your main strategy has been to get your notes ready.
Yes, ma'am.
And then focus on revisions.
Yes, ma'am, multiple
So Vanshika, I really want to know from you कि जब हम बोलते हैं कि get your own notes ready, how important do you think is that aspect? Yes, having a set of handwritten notes which you can go back to. And do you think that they were useful for your prof exams as well? And how did you use them, especially, you know, in your internship year when you were planning to really give the exam in with full swing, you know?
Ma'am, I made few handwritten notes in the beginning, and then in the middle I had to switch to printed notes because I was falling short of time.
Okay.
So, but obviously the retention of handwritten notes is always going to be better than printed notes. I agree to that. So it depends on the time every student has.
True.
And prof exams also, the notes were very helpful. My primary notes, I used them only for all the subjects actually, to clear prof. Yes, ma'am.
So that's great, and I think that's a very, very, heartfelt preparation strategy. What she has done, that's what she wants to put across as well. So Vanshika, मुझे ये बताओ, the other important limb of preparation is your MCQ practice,
yes,
right? So you use the TND papers as well, and I'm sure you've been giving the grand tests and the SWTs and doing a full round of preparation. I really want to ask you 2 things. One, do you think the TND papers were of good quality? Because, you know, as we can see, even the INICET has been changing their pattern very often now, and you do come across various types of questions, from single best answers to clinical vignettes, to match the following, to arrange them in order. So, you have to have an exposure to all sorts of questions. So I would really want to know, one, about the TND paper itself. Second, how did you plan your revision when you had to do the subject again? What was the strategy at that time?
Ma'am, I found the TNDs very useful. They were a mixed bag of single liners, multiple option correct. Right. So all levels of questions were covered there. And more than the question, they covered the important topics there, and they teach the entire topic over there. So it's again a source of concise notes for the subject. All the important PYQs are covered in the TND. So I used actually my primary notes plus TND notes to create my own concise revision notes. Okay. And that's what I used towards the end. So after my primary reading, I planned for 3 revisions before the exam.
Great.
It was like basically for every subject I had created folders of screenshots of particular notes, and that's what I used for the revisions.
Okay. And now let's talk about analyzing. A lot of us or students would give stress on practicing questions and giving grand tests, but not everybody is focusing on the analyzing part. Yes, and in order to ensure that your number of correct questions improve, I think that is important. Yes, so can you tell us, how did you utilize the test papers and the grand test papers with that regard, and how did you work on the analysis and strengthening your weak zones?
Ma'am, instead of just attending the discussion class, I used to make it a point to attempt the test first and then attend the discussion, because that's when you get to know what was wrong in your way of thinking and approaching the question. Right. So, and even after the grand test, I used to give 1 day to review every GT. Okay. And not only the wrong questions, basically I even used to look at the right questions, because it was more than just correct and wrong, it was also a learning tool. And the similar questions are basically repeated. Once you start writing a lot of GTs, we realize that the same questions are important, same topics everywhere. Yes. So I used to review all the papers nicely.
So I think everyone who's listening, Vanshika, out, you must realize that even toppers are putting in a lot of effort. Yes, so she's spending 1 day on analysis, and that is, I think, the reason why she's sitting here and why I am sitting next to her. It's an honor, right? So you have to realize that unless you focus on your weak zones, it's very difficult to come up the ladder, because then you will plateau. Okay, and now Vanshika, can you also help us on revision strategy? We often tell students that your revision has to be selective. Yes, ma'am. Let it be retrograde. What was your plan, bacha?
Ma'am, like my timeline was by the end of August, I finished my primary reading and annotation of my notes. Okay. And then in September, I planned my first revision till mid of October. Okay. And then the rest of the October, I did the third revision, like the second revision per se. Okay. And in the last 10 days, the third revision.
All right.
So I just used my last moment folders for all the subjects. I basically bookmarked the pages. I wrote my notes online. I converted them online. I took photos. Okay. And I converted all my notes online. So I used to bookmark the pages. I thought I need to revisit before the exam. Okay. And those bookmarks kept on decreasing with subsequent revisions.
That's the point.
So those notes only I used towards the end.
I think very, very aptly said, and a very important piece of advice that, she made notes, but she kept concising them because of the analysis that she was doing. So eventually she was able to reduce her work, and that is what is smart study. There is no doubt that hard work का कोई replacement ही नहीं है, but I think Vanshika would agree that when you're appearing for competitive exams, it's very important to go ahead with a strategy. है ना? अच्छा वंशिका, बहुत सारे बच्चे when they would listen to you, they might just ask you, मैम अगर हम कुछ छोड़ते हैं रिविजन में तो हमें फोमो होता है. Yes, so I'm sure आपको भी लगता होगा कि कहीं ये ना रह जाए, वो ना रह जाए. So उस टाइम पे what was the thought process so that you're not just collecting material but actually putting what you have to use?
Ma'am, the PYQs helped me concise the revision material.
So did you use the PPE kit for that?
Yes, ma'am. I used to watch few videos like where I had doubts in the answers, so I used to see the video explanations of those questions.
Great.
To clear the concept. Yes, ma'am.
Okay. अच्छा, so Vanshika, जैसे मैंने पूछा कि there is a lot of things available, मगर end में जब हम तैयारी करते हैं, were you stressing more on your notes, which you have already mentioned, but I just want a little more depth on it. The MCQs, the tests, what was your key thing to do, let's say, let's say 10 days before the exam?
Yes, So ma'am, like first 10 days of November, I had planned to revise my revision notes for all the subjects.
Okay.
I completed that. In the last 2 days, I had kept for revising the questions which I did repeatedly wrong. I had written them separately, and I had highlighted few tough ones which I would forget if I don't revise.
Okay.
So those last 2 days, I kept it only for that, and classification systems of surgery.
Okay.
I had taken screenshots and made a different folder for TNM stagings and classifications. So I just went through that folder last.
I think it is a very, very well-planned study as well, and you're doing it with your internship.
Yes, ma'am.
So, which is absolutely commendable, because you've got your internship to do, you have to plan your studies, you have to revise. So there's a lot of effort goes into it, and it can only be done when you're consciously not just counting number of hours of study, but actually putting them into effective work. Okay, that's wonderful, Vanshika. Acha, Vanshika, जैसे कि इस बार suddenly, you know, AIIMS people announced that there's a change of pattern. It'll be 2 sets. And that was quite a setback for some of them, because they were not really ready for the change in the pattern. So now I want to ask you, did you appear for the CBT, and do you think going to the center, getting accustomed to seeing different types of questions, different formats, even different time frames, because we also conducted the CBT in 2 slots.
Okay.
So yes, you might have opted for a morning slot, but we always do it in 2 slots.
Yeah.
So let us know something about the CBT as well. I mean, your experience about it, and then yes, the experience of the real exam.
Ma'am, the CBT was really important, because the most important part of it is that it decreases your anxiety of the exam day. Taking an admit card to the center and writing an exam 3 hours straight, and not in the comfort of your home, in an actual exam center setup with so many students around you, with the invigilator coming also taking your sign and everything. So it was really mimicking the real exam, and it does decrease your anxiety on the real exam day. And the question pattern also, I feel, was very appropriate, and it was similar to the real exam. It was lengthy as well. There were a lot of multiple choice and match the following the way it comes in the real exam. And the analysis also helped me a lot, because again, they were covering all the questions covered the important topics which are repeatedly asked. So it helps you keep reinforcing those topics.
Okay, so Vanshika, there were a good set of, I would say, all types of questions in this exam as well, and there were certain image-based questions. So can you do an analysis about the type of paper itself? And you said you had the evening session, right?
Yes, ma'am.
So if you know something about the morning session, if you want to tell something in comparison between the 2 sessions, what is your input? What would you suggest your juniors or colleagues who are going to appear for the next exam? Do you think the pattern is going to remain the same? So what are your inputs?
Whenever there are 2 shifts, one paper is bound to be tougher than the other.
Yes.
So I don't know if it's a personal bias or something, but seeing the recall questions, I personally feel that the second shift was a little harder than the first shift.
I think I would agree on that, because we've taken a feedback from a lot of students, and yes, that was majorly the feedback as well.
Yes, ma'am. So like our shift was little lengthier as compared to the first shift, and the repetition of the PYQ also was little less. Like the first paper had stat repeats from the previous years. We had little less repeats comparatively.
Okay.
And there were a lot of image-based questions, which I think was true for both the sets.
Yes.
The pictures are usually not very clear, so we should actually pick up the keywords in the question stem itself, rather than relying on the image.
That's a very great piece of advice, because as she said, yes, we also got messages saying that they couldn't zoom the image, or
Yes,
the
ma'am.
clarity was not good. But the key is that you have to appear the way it is.
Yes,
right?
ma'am. It's
So-
same for everyone.
Yes, so the mindset of the topper is the mindset, that we all need to have. And that's why she's here, to tell you that strategy is important, hard work is important, mindset is also equally important. So when you are sitting there, how do you tackle things like this?
Yes, ma'am. We have to be very quick. And I was initially a little slow, because I had that habit of that the test will get completed in time by giving the GTs. But the real exam was actually lengthier than the GTs we had appeared for.
Okay.
So because there was a lot of scrolling that happens there. The question doesn't appear in one screen.
Yes,
So when you scroll horizontally and vertically, it does take a lot of time. So I got panicked in between, but then you have to keep your calm over there and plan your remaining time accordingly, and I was just rushing with the questions. So I started reading the last line of the question rather than the entire question, and just working on elimination. Then I had to pick up speed rather than getting tensed at that moment.
So I think that's how you tackled it, and you did it pretty well. So whatever you managed, you were well prepared for it, and you did a fantabulous job, and
Thank you,
you're
ma'am.
making us all proud.
Thank you so much, ma'am.
Okay. Vanshika, so you said that there were a lot of image-based questions as well as clinical vignettes. So now I would want to ask you, did you attend the DVT, maybe online, or did you go through the image-based?
Ma'am, only for a few subjects. I did not have much time remaining in the end.
Okay. And also on the same note, how did you revise the IBQs, or did you not see them separately? Because I feel they were routinely covered in the classes as
Yes,
well.
ma'am, they
So
were
any input on what students can do in future?
Ma'am, I think DVT is a very helpful source of revision, although I was not able to see all the subjects because of lack of time.
Yes.
But I saw, like, the OFTHA DVT helped me a lot. So there are some subjects which are totally relying on on pictures. So for those subjects, it's really important, like anatomy, OFTHA, and the graphs in physio, all that helps you a lot.
Yes. Okay. So Vanshika, students would definitely want to know now some more depth about the paper, especially from the topper, right? So I want to ask you, can you contribute something in terms of weightage of subjects? Maybe, if not specifically one subject, maybe prof-wise?
Yes, ma'am.
So one is that. Second, did you go aggressive in the paper? How many questions did you attempt? How many did you keep for review? What would be your suggestion to others for the same?
Yes, I think 60% questions were from first and second prof, and 40% were from the clinical subjects. And I think this pattern has been maintained in INICET throughout. Yes. So, and obviously first and second year questions they are the rank deciders, I would say, because the clinical STEM questions are not that tough. And the first, second year subjects are like that. If you master them, you will get them right. They cannot be twisted a lot.
Right.
And ma'am, about flagging, I did not flag questions because I was told by my seniors that you won't have time to revisit those questions in the end. So, and then those questions are not even submitted, like they don't mark them.
You have to go back and
you have to unflag them.
Yes.
Otherwise they won't be counted in the evaluation.
So again, please, people who are listening to her, listen to her very carefully. Less mark for review, because sometimes this happens. As she said, the pattern changed. It was a little lengthier, and it was anyways difficult for her to go back to the questions. So listen to the advice. Just do it in one go.
Ma'am, I made 2 columns, one for questions that I've never heard about, so there's no point of reviewing them. And the other column was that if I spend some time, I can mark this question.
Great.
So towards the end, I just had time to review the questions the second column questions basically.
So a very intelligent strategy, I must say, and a very useful tip as well.
And ma'am, I think we should go aggressive in the paper. At least 185 plus questions we need to attempt. I attempted around 192 questions because the negative marking is only 1/3. So there are still chances that by guessing we'll get the positive result only. So yeah.
Okay, fair enough. I think that's absolutely right, because especially for people who've worked hard and who know that they can do well, you should definitely go aggressive because every question counts.
Yes,
okay, Vanshika. And Bache, there's also something like, did you go order-wise or backward? And were you skipping a lot of questions in between? I think you were not, but
no,
just to sort of...
I attempted the paper in order only because that's how I had attempted all the GTs.
Right.
So, and it creates a lot of anxiety for me to go back to questions because then you have to keep submitting it and you save that answer. So I attempted them in order and I just kept writing those questions which I have to review. So, and don't leave too many questions for review in the end because again, you won't have time. I had like 6 minutes remaining in the end. So I could just review that column questions I had written. I had about 3-4 questions which I did not know anything about, so I'm not going to attempt them. The other column I had around 8-9 questions. So there I was able to eliminate 2 options and then I could pick the best one.
So I think that's how it should be. If you're able to rule out 2 options, you must definitely use your basic knowledge and
yes, ma'am.
Attempt them. So I think she's a very, very bright girl and who's gone ahead with a strategy, just like a true warrior, I would say. So, and she comes out a winner. So what better than that? And Vanshika, मुझे ये भी जानना है बच्चे कि अब आप क्या आगे करना चाहते हो? What branch do you want to pursue?
I'm interested in pediatrics. I want to be a neonatologist.
Wow, that's and a sweet girl and a pediatrician. So that's like the best combination. But anyways, I'm sure whatever branch she is going to pursue, she is really going to exceed in it. Acha Vanshika, any special advice that you would want to give to people who want to give the exam in May? And also, since she is an undergraduate from AIIMS. Let's get some inside information. So are we likely to have so just kidding. So are we likely to have AIIMS INICET in May as well?
Yes, ma'am. Most probably.
Likely, yes.
ma'am.
So okay. So can you give, number one, in short, let's say a 4-month strategy for people who would start now for May, and then some motivation or something that kept you going and you would want to pass it on as a legacy?
Yes, ma'am. Ma'am, I think we should plan for at least 2 to 3 revisions, at least 2 revisions before the exam.
Okay.
So the first 1.5 month strategy should be to just concise your notes.
Okay.
In every reading, you should know what you want to revise.
Perfect.
So knowing what not to read is equally important. So I think we should just annotate our notes, complete that in the first 1.5 months and keep concising notes for revision. And question practice is equally important. Like I used to give 2 to 3 hours dedicatedly at night to practice just PYQs.
Great.
So, and not necessarily of the subject we are studying. You need to be in touch with all subjects. So just do it paper-wise rather than subject-wise.
That's again something that people would definitely want to know. Yes.
And ma'am, I think consistency is the most important thing that worked for me both in UG and now as well. And I'm not someone who studies for like 16, 18 hours a day. I used to study, like towards the end, I studied 8 to 10 hours a day. And
that's pretty much with your internship. I think you've pulled it off, and that's all for that.
So ma'am, consistency is the most important. Like if you're starting, so even I had that kind of inertia sitting for long duration in the beginning, but I used to make it a point to at least study 3 to 4 hours every day. Like even when I'm taking a break day, I used to study for at least 2 hours. So consistency is the key, I feel.
Yes. So I think absolutely right when she says that, there is nothing that can beat consistency, and she has very nicely put forward her strategy. Whatever she's done, it's been a very, very kind advice and very valuable advice as well, which I think is going to be useful for anyone who's listening out to you. And now, do you want to say anything special, something special for your mom and dad, or anyone, your friends, your colleagues, your teachers?
I'm really grateful to my parents, my friends, all my teachers, and God as well for this success. And I would just like to say that trust the process and keep going. It will be worth it someday.
Such a humble girl and such a beautiful soul, and I'm sure, Vanshika, कि आप जो भी करोगे आप उसमें बहुत अच्छा करोगे.
Thank you so much, ma'am.
Thank you for making DAMS a part of your journey.
Thank you.
And it's been a pleasure interviewing with you and knowing your strategy and seeing how clarity of thought was there while you were preparing. Yes, and I think those are some of the most important ingredients for someone to come out as a winner. So heartiest congratulations once again to the entire DAMS family, and my regards and congratulations to your proud parents as well. So all the very best, Vanshika.
Thank you,
in
ma'am.
life, in future, and stay connected to us.
Yes, ma'am, definitely.